Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Renal cell carcinoma. Renal cell carcinoma is an encapsulated structure. Actually, benign structures are encapsulated, whereas malignant structures they are not encapsulated, they undergo easy invasion. But this renal cell carcinoma is one of the tumor which is encapsulated, and you see spontaneous regression occurs in renal cell carcinoma. Then one more important thing is it is refractory to cytotoxic agents. It does not produce easily, does it undergoes spontaneous regression, and it is refractory to cytotoxic agents. Then if it is refractory to cytotoxic agents, then we should give the patient biological response modulators or modifiers can be given, like interleukin 2 or interferon alpha receptor antagonists can be given. In renal cell carcinoma, there will be a prolonged period of stable disease is seen. So if you see the most common ones, the most common type of renal cell carcinoma is clear cell carcinoma. Clear cell carcinoma is the most common type of renal cell carcinoma. If a question is asked, what is the most common type of dialysis associated cystic disease? Dialysis associated cystic disease is papillary carcinoma. What is exclusively associated with sickle cell trait? Medullary cell carcinoma is associated with sickle cell trait. Best prognosis. Which disease has the best prognosis? Chromophobe carcinoma has the best prognosis.
thank you and thank you for watching.